particular patient was bedfast, almost non-responsive, on a feeding tube and taking a long list of medications. As I was researching her drug list, I came across 2 medications that were contraindicated with at least one other medication, as well as a severe category of potential drug interactions. This didn't sound good to me. I brought this to the attention of my nursing instructor, along with the proof in the drug reference. She stated that these medications had been given to this patient for quite some time. She added that the doctor had to prescribe them, the pharmacist had to fill them, and the staff nurses had to check and dispense them to her many times by mouth. She was certainly trying to convince me that this must be acceptable practice because these drugs had made it through so many checkpoints thus far. She ended up contacting the doctor without telling me at that time. 2 days later, my instructor informed me that my patient's medication regimen had been changed as a result of my findings. The next week we made rotations. I greeted my patient in the whirlpool room. She hadn't been outside of her bed bath, outside for anything except a bed bath in years. She was smiling and talkative, and by the end of the week, she was sitting upright in the dining room for mealtime socialization. I learned that paying attention to detail can make all the difference in the world and in a life. Also, I don't rely on others in attention or lack thereof. Number 2, explain a difficult encounter you had with a supervisor, team member, or coworker, and how did you handle that situation? As the nurse manager of my previous job, I reported to the executive director of the center. One day, she was assessing an employee's dialogue as she listened outside the closed door. The director made several comments to me thereafter, saying she didn't like the way the employee phrased some information, and added she wished she hadn't included several topic items in the discussion at all. She then asked me to go to that employee and tell her that I had been listening outside the door as she counseled the client on parenting. She told me to add that I was listening for training purposes. She instructed me to tell her that it wasn't appropriate for her to discuss health-related topics because she was not a healthcare professional. She justified telling me to do this task with the statement, "I think this should come from you because you are the nurse." After wrestling with a mixture of emotions, I feel that I handled this situation the best that I could in that moment. The director asked to be present when I talked to the employee, so it was handled in my office, just the 3 of us. I simply told the employee that I had heard that she was speaking about healthcare issues when counseling the client, and if she could leave these topics up of discussion with me as the nursing professional, then that would be at the best interest of our center and the client. The employee verbalized understanding and agreed. She never knew the details of the entire issue, but I felt deceitful all the same. Number 3, discuss a time that you applied initiative, creativity, and problem-solving skills to a situation, and what was the outcome. Oftentimes, when working for a nonprofit organization, money is a scarce resource. On one occasion, I can recall needing disposable table drapes for an exam room. The center was over budget, I was told, but I had patients coming and would need this supply. I knew that where there was a will and or need, there was usually a way. I walked next door to a home health medical supply store to inquire about our need. It just so happens they had a leftover box of table drapes that they could not use or sell any longer. They donated them to our center. Mission accomplished. Number 4, give an example of how you persuaded or convinced others to accept an idea, and why was your method effective? I convinced our team to participate in a Color Up 5K fun run. I persuaded the employees that we were mentoring adults on parenting and making healthy choices, though sometimes uncomfortable, and that we should lead by example. Physical fitness is important to holistic well-being, especially important when caring for others, i.e. parenting and mentoring. I started the team and invited employees, board members, and donors to participate. This undertaking was challenging, but successful. Several of us participated, posted it on the center's website, and the following year there were at least twice as many participants, including clients. Number 5, how have your leadership, volunteer, work, and academic experience prepared you for the opportunity you seek in your application? Nurse management experience in a nonprofit, community-based organization, proficiency in the nursing process including assessment, planning, intervention, and evaluation, excellent rapport and communication skills experience in BLS and in limited obstetrical ultrasound, as well as recent experience providing clients with free pregnancy testing, referrals, and resources, assisting with managing the non-licensed staff to serve the client needs, and increasing positive choices and outcome evaluations, including case management, have prepared me for this opportunity today.